More than 15% of the population suffer from dry eyes, and we'll be speaking with Professor David Tzadok, an expert in dry eye disease, and Geula about a new and innovative technology. Geula, you suffered from dry eyes. What are the implications of having dry eyes?
The implications include feeling constantly tired, even during hours which I should not normally be, dazzling and glare from strong lights, a sensation of having sand in my eyes, and a constant need for eye drops.
For how many years have you suffered from dry eye?
For 5 years.
Did it start all of a sudden?
No, it happened gradually.
At the beginning, you received conservative treatment and then received treatment in the context of a clinical trial. Tell me about that.
At the beginning, I used all of the different types of eye drops and tried many different things. During one of my checkups, my doctor recommended that I make an appointment with Professor Tzadok to see what other options existed for me.
And your life changed?
Yes, completely.
Professor Tzadok, what are the main causes of dry eyes? A dry eye disease is very common among the elderly population, affecting about 25%. Dry eye is more common among postmenstrual women and also in people that work with computers or screens, which cause us to blink less. Air conditioning also causes eye dryness. Certain diseases lead to dry eyes, including high blood pressure, diabetes, some autoimmune diseases, and arthritis. People that wear contact lenses or have had laser surgery also suffer from dry eye. Is it dangerous or just an annoyance? It is mostly an annoyance. Dry eye drastically impacts one's quality of life. What is the normal and accepted treatment nowadays? Dry eyes disease is divided into two types: dryness caused by increased evaporation of the tears and dryness caused by a lack of tears. Treatment for evaporation of tears includes massaging of the eyelids and use of compresses to unclog our oil-producing glands. Treatment for a lack of tears includes eye drops and artificial tears. There is a multitude of artificial tears on the market, all of which are fine provided they are preservative-free. Tell us about the innovative therapy. How does it work? The new therapy was developed by an Israeli startup company and uses magnetic stimulation. Is it a one-time, single treatment? Treatment takes 10 minutes per eye and has a long-lasting impact for about 3 months. There have been cases where the effect was felt even longer, which is a significant benefit in terms of one's quality of life. Is there any causal damage or any side effects? 35 people have been treated so far in the clinical trials, none of whom reported any side effects. In the clinical trial, we measured both systemic side effects and side effects specific to the eyes using different imaging techniques, and did not observe any side effects whatsoever. Where can one receive treatment? The treatment is currently given in the context of an ongoing clinical trial at Shaarei Tzedek Hospital, Bellinson, Wolfson, and Hadassah Medical Centers. Geula, do you recommend the treatment?
Yes, very much so. I would like to add that there is a lot of stress in my everyday life not to forget my eye drops. When I leave the house, go on vacation, or on errands, so there is always this stress and pressure not to forget the eye drops.
And the treatment changed that?
Totally. I myself work on the computer and need to read a lot. I drive to work and with the AC on. The glaring from the car lights makes driving very dangerous for me. My eyes are still technically considered dry, but I no longer have the sensation of sand in my eyes. And it's been 6 months since I received treatment.
From a one-time treatment?
Correct.
Amazing. This really is a breakthrough. Thank you very much to Professor Tzadok and Geula.